Well, good afternoon, everyone. I'm joined today by the Health and Social Care Minister and also by Dr. Henrietta Ewart, our Director of Public Health. Without further ado, I will ask the Health and Social Care Minister to take you through today's statistics. David.
Thank you very much, Chief Minister. The total number of tests undertaken now stands at 2,674. Of those, we have had back and concluded 2,632. We're awaiting, therefore, results of 42 tests. The total number of confirmed cases remains the same as yesterday. There has been no return of positive results, so we remain at 307. The total presumed recovered is 221, leaving 70 active cases. It is, however, with great regret I have to announce a further death in the community, bringing our community deaths total now up to 12, with the 4 in hospital. That makes a total death toll now of COVID-19 of 16. Thank you, Chief Minister.
Thank you, David, and our thoughts and prayers go out to the family of the person who lost their life with this tragic illness. Thank you, David, and the difference between the situation here and across in the United Kingdom is pretty stark. It is important that we remember this. Before we hear from Dr. Ewart, I would like to cover a few points of my own. I know that a lot of you found the Chief Constable's appearance yesterday interesting and reassuring. I certainly did. I know from your comments that a lot of you were also reassured when you understood what the changes did and didn't mean for you and for the island. I said that I would come back to you today with this morning's meeting of the Council of Ministers with a little bit more detail on what activities people can and can't do from tomorrow. As I've said, we will be publishing guidelines on our website and on social media, but maybe I could give you some headlines. On sport and recreation, the Council of Ministers agreed that we are not ready to open sporting venues or facilities that bring together groups of people. The underlying principle of the measures we have in place is to minimise the risk of spread of the virus. The time is not right for us to open gyms, sports clubs, etc., or to allow collective sports. You can go out and exercise if you can do so whilst maintaining social distancing rules. And this is an important point, with people from your household. So that doesn't mean, say, family and friends, it means people from your household living with you. So what does this mean? Yes, you can kick a football in the park. Yes, you can walk along the promenade or through a glen. Yes, you can do your yoga on the beach, but with people from your household. We are not yet in a position where we can allow you to do this with your extended family or your friends. Now, I know not being able to meet with friends and family is tough, and I hope that we will be able to make this change before too long. But we are not ready to make that change yet. The other important principle around sport and recreation is not to burden our emergency services. Please don't do anything that could take up valuable time or bed space in our hospital. We need to trust you to make the right choices. When I listed all the things that would not be changing tomorrow, I didn't mention non-essential shops, bars, restaurants, etc. I should have. Again, we are not yet ready to reopen these. We are keeping this under regular review. Our approach is simple. Change, track, assess, and review. We will make carefully considered changes. We will track the impact they might have. We assess whether the impacts on the capacity of our health and social care and what they, if any, they are. We will review and decide if we can go further. Robust data will be incredibly important to us getting this right. The Health and Social Care Minister will be focusing on this in his briefing tomorrow alongside our experts. One of the rich streams of data that we have is from our testing and tracing. This is the responsibility of our public health colleagues. I would therefore like to hand over to our Director of Public Health, Dr. Henrietta Hewitt, for an update. Over to you, Henrietta.
Thank you. As the Chief Minister said, testing and tracing is going to be vital to enable us to start relaxing restrictions. It's the mechanism by which we will, as quickly as possible, identify any new cases arising, and we can then follow those cases up to find their close contacts and advise them about isolation as well, in order to contain spread beyond that new case. We have established arrangements for contact tracing already, because it's always been necessary for the sort of things we've always had to look into, such as sporadic cases of TB or episodes of food poisoning that could be linked, e.g. through a restaurant or maybe, a big gathering like a wedding. So within public health and also the environmental health officers, that ability has always existed and those professional skills have always been there. However, what's different now is the sheer order of magnitude that we may have to respond to in respect of COVID, and the fact that this is unlikely to be just very occasional and sporadic. It's going to be something that we've got to be able to keep on top of going forward, potentially in the long term. So rather than relying on our existing small teams in public health and environmental health, we are getting underway the arrangements to set up a discrete, self-contained contact tracing function, which will sit within Cabinet Office under the management of GTS, but very much with professional links and oversight into public health and also into environmental health, to make sure that all those professional disciplines are supporting the people that we'll be recruiting to act as the contact tracers. This will set up a system similar to we've seen in other countries such as Germany, Singapore and Taiwan, where contact tracing has been shown to be so valuable in keeping things under control, enabling us to identify as new cases are beginning to appear and what those patterns of spread look like. And going forward, enabling us to balance off, allowing lightening of restrictions with quick action and control if new cases are identified.
Thank you very much, Dr. Hewitt. And thank you very much for the update. And thank you for everything you and your colleagues have been doing. I am incredibly grateful. Before I go to questions, I would like to make two final points. Firstly, on transparency. This is something that is personally important to me. I committed to you when we started these press conferences that I would be as open with you as possible. We are trying our best to share information with you as soon as possible and as clearly as possible. We may not always get this right, I know that, but we are trying our best. If there are any topics that you would like us to cover at these briefings, then let us know. We won't be able to cover all of them, but let us know and we will see what we can do. We do welcome your views. Why not comment on Facebook or Twitter? The second point is about Abbotswood. The deaths that we have seen there are heartbreaking. I know some people have been asking about reviews or investigations. All I can say at the moment is that right now our absolute priority is the welfare of the residents. As the Health and Social Care Minister has mentioned a few times this week in response to questions, we have stepped in to support Abbotswood. We are doing this in a variety of ways, clinical and non-clinical. We have provided support on deep cleaning, laundry services and essential repairs. A team of clinicians and teams supporting them are ensuring that the residents receive the best possible care. I will now take questions, and first I have today is Sam from Isle of Man newspapers. Sam.
Good afternoon, Chief Minister. So we could start. Have you seen the video that's been circulated today by Dr. Rankin, where he's been pleading, his GP who's been working, and he's been pleading with the government not to spend any, release anything on this lockdown and to carry on with the current circumstances. Have you seen it, and how can you respond to that as a government and say that we're going, if we've got medical professionals saying that we can't end it?
Well, thank you, Sam. I think I'll bring David in on this one. Yes, I have seen it, and obviously it's a difference of opinion. I respect his right to have an opinion that's different from ours. But I think it best if I bring in the health minister on this one to give you a full answer. David.
Thank you, Chief Minister. Can I start by thanking Dr. Rankin for his long-term commitment to meds? He has absolutely worked exceptionally hard within the meds environment, and it's very, very much appreciated, because it's one of those services that has had to continue to run and to continue to perform throughout this outbreak. Now, clearly there is a difference of opinion. Dr. Rankin is as entitled as anyone else to have their own opinion on this. All of the measures that we have taken have been done with clinical input. I think I've mentioned several times, and the Chief Minister mentioned on Tuesday, that the clinical leadership body, Public Health, have all been involved in helping to draw up the measures that we are taking. There is a couple of points in the video that I do want to address. The first one is around Newlands. It was stated in the video that Newlands, this is where people are fighting for their lives. I have to make absolutely clear that Newlands is basically a step up, step down facility. At the moment, it is not even half, or it's just over half full. In relation to the people in there, as I explained yesterday, they are people we have moved from Abbotswood up to Newlands so we can undertake the deep cleaning, and the plan is once that deep cleaning is done, they will be moving back out of Newlands back into their home. So I just need to clear that fact up. Also, one of the things that was raised was, we should really wait until there is a 7-day instance of 0 cases. Well, actually, you wouldn't. If you were going to go off that theory, you'd actually wait 14 days because of the incubation period of the virus. But I think what's important is, I can see where Dr. Rankin's coming from. I can understand these are scary and concerning times for people. But the suggestion that this virus is going to go away sometime soon if we do certain measures and we will completely eradicate it, I'm afraid evidence around the world is not showing that. So we do have to learn to live with this virus, even if it is in low levels, for some substantial period of time in our community. We can't stay in lockdown forever. The Chief Minister in his speech has touched on before around people with mental health problems, with domestic abuse, all things that concern all of us. And what we are doing is baby steps. We have explained all along that any decisions we make, the data takes about 8 days. And if we find in any way, shape or form it is affecting our response, then things will be reconsidered. But we can't stay as we are now forevermore. And I don't believe, certainly the medical evidence around the world doesn't support the fact that this virus is going to go away anytime soon, no matter what actions have been taken. As an island, we have been able to take actions that others haven't, such as the border closures, which if you look from the date we closed the borders, first to non-residents and then to everyone, it's clear to see on our graphs that that has had an effect of suppression in the community. So we have been able to do things, and that's why we can now move to a stage of slowly moving away from the position of total lockdown that we've been in. And I don't know if Henrietta wants to come in and add anything from a public health perspective.
Yes, simply to absolutely support everything that you've said, to say that this has had very wide debate with clinicians across the DHSC. So as you've said, Dr. Rankin is entitled to his view, but the consensus view is different. We do have COVID circulating in the community. Admittedly, initially it obviously came in across the borders. That travel-related incidence is now down to very low levels, but we do know that it is still here in the community. As the Minister has said, the 7 days suggested by Dr. Rankin doesn't fit with what we know about the incubation period. And we also know that there is the potential for there to be the very occasional outlier who might still be infectious 21, 28 days later. So there is no perfect golden window of time that would give you a safe place to open up again. And in any event, we have to balance that, the benefits of maintaining strict distancing and isolation against all the disbenefits to people's mental health, community resilience, the economy, and all the rest of it.
Thank you, Chief
Sorry,
Minister.
Mr. Nash, just before you go, can I just ask a clarity point? Is the death in the community another Abbotswood case?
Yes, I can confirm, tragically it is.
Thank you.
Right, thank you very much. And thank you very much, Sam. Next we have Amanda from Jeff the Mongoose. Amanda.
Thank you. We have a question for Dr. Hewitt as well. I've previously asked about the antibodies from the blood of recovered coronavirus patients being used to treat those who are currently battling the illness. I wondered if you could tell us if you're hopeful about this potential treatment and if it could be rolled out on the island in future.
Dr.
It
Hewitt.
could be in the future. At the moment, it is undergoing properly designed and regulated clinical trials across. Now, we can explore, and we are doing, the possibility of actually linking as a site into that bigger trial. What would absolutely not be appropriate here is to get to the position where we give things a go because they might help, but they have not been proven. That way lies the potential for disaster and actually doing more harm than good. So there's two issues there. One is exploring whether we can become part of the UK trial, which is ongoing. And secondly, once the results from those trials, and there is now a very rigorous system in place across to do fast track trials, which get the results out as soon as possible. So we're linked into that. And as soon as these things become approved, then we would expect to roll them out here.
Thank you very much. And actually another question for you. I wondered if you had personally been involved with the support strategy at Abbotswood and what recommendations you were giving there currently.
We're involved at one remove in terms of providing professional health protection advice to our operational colleagues in DHSC, and we've been very happy with everything that they've done.
And what advice have you given to them, sorry?
Well, what advice? You'd have to ask a more specific question than that, because obviously there are various elements. For example, reinforcing the infection prevention and control measures. The responsibility for infection prevention and control actually sits within operational DHSC anyway. They have very skilled professionals that are getting out there and overseeing that, because that actually is the crux of controlling any outbreak. It's getting those prevention and control measures in place. And then that's backed up by strategies around testing and swabbing. So we now have a policy in place where an index case is identified in a residential care setting. That triggers testing for all other residents and indeed staff. That enables the identification of pre-symptomatic or asymptomatic carriers. They can then be taken out of the picture through quarantine or self-isolation, and then obviously contact tracing of their contacts can happen to again break the lines of transmission, which is what's so important in getting these things under control.
Thank you very much.
Thank you very much, Amanda. And now I hand over to Alex Wotton from Manx Radio. Alex, good afternoon.
Good afternoon. My questions are for the Health Minister.
Okay, I'll bring David in.
Thank you.
Good afternoon, Alex.
Good afternoon. Relating to the Abbotswood care home, what measures were in place to stop the virus getting into the home to begin with, and how did it get in, do you know?
So in relation to the virus entering the care home, the precautions that were taken was visiting was stopped. In precisely the same way as other homes did. There was also advice offered from DHSC around the laundry services, around the equipment that staff would require to be used. We think we are aware, but we're not sure 100% of how it came into the home, but I can't obviously comment on that at the current time.
How many more residents of Abbotswood currently are diagnosed with COVID-19, and why weren't the 11 people that have died in the community taken to Nobles before their deaths?
Well, firstly, the thing I need to stress is people will only be admitted to a hospital setting if the hospital setting is appropriate. So if people are declining due to COVID-19, they require hospital level intervention. Those patients who died in the community did not require hospital level intervention. Hospital level intervention would not have changed the outcome. We also have to remember that within nursing homes, and this is something that other jurisdictions have seen as well, we have a large cohort of vulnerable people who have underlying medical conditions as well. And that is where, so when the virus attacks them, it can be quite quick. So, but none of these patients reached the stage where they would have required hospital care other than the one who was already admitted to hospital.
Sorry, so how many are currently diagnosed with COVID-19 in Abbotswood?
So I believe the figure which I gave the other press briefing was 47.
47. Okay, thank you.
Thank you very much, Alex, and thank you very much, David. Now, if I can move to Rob Pritchard from 3FM. Rob.
Good afternoon, Chief Minister. My first question is for the Health Minister, please.
Okay, David.
Good afternoon, Rob.
Good afternoon, Minister. Given, obviously, in light of the video that Dr. Rankin has done, how are medical professionals who may disagree with the relaxation of certain restrictions, how are they able to get their message across to yourselves and other senior health officials? Is this video for the fact that they may not have felt their voice was being heard enough?
Well, I think the first thing we need to stress is, as I've said again, and I will repeat it again, Dr. Rankin is perfectly entitled to have his view, to have his opinion. He is one medical professional. We have a clinical leadership team. We have a proper assessment structure. We have public health, with the Director of Public Health here with us today, that also has a professional reporting structure, and they report direct into the National Strategy Group with recommendations, and from there into Council and Ministers where the decisions are made. So there is a proper hierarchy of basically assessment and then recommendation.
Just to clarify just a little further on that, if medical professionals do have these concerns, how is it actually worked out each tier? Is there a vote that they have to report to their senior manager in their departments?
Well, I'll let Henrietta come in on the details of how it works with public health and the senior clinical leadership team. But as in any walk of life, Rob, there is always going to be disagreements. There is always going to be concerns. When you sit round a board table in the private sector, there is always differences of opinion. And what you have to do is come to a consensus, which is what Henrietta has talked about in the past. And that's what we do in exactly the same way. But I'll bring Henrietta in.
Yes. In the senior clinical and public health leadership team, it's by debate, discussion and consensus. Certainly to date, we have never had a split such that the chair has felt the need to take a vote. Consensus has emerged in the discussion of documents. Usually it's document-based. The documents are circulated beforehand. People can add comments, amendments, suggestions, changes. That's then debated around the table or with virtual participation around the table. And the decision is made. And as I say, to date, we have not actually had to go to a vote on anything.
Thank you. My second question is for the Chief Minister, please.
Okay, and just before I take that, can I just reiterate the point that David made? If you look at any profession, if you put 100 people in a room and ask them a question, I very much doubt you're going to get 100 all agreeing with the same viewpoint. But we have our senior medical and clinical teams who have made a recommendation, and you've heard from Dr. Hewitt that the chair has never had on any of the decisions to cast a casting vote. Obviously, we're going to get differences of opinion. We respect people's rights to have differences of opinion, but we listen to our senior clinical and medical teams at all times. So, yes, your next question, Rob.
Thank you. On a slightly different note, we'd seen some murmurings online today regarding mirror payments and that some hadn't received them. Someone has claimed online that when they spoke to Social Security, the person from Social Security told them that there had been some sort of issue and that they'd already received at that point, which is now several hours ago, the best part of 1,000 calls about it. I just wondered if you knew what exactly had happened there and why.
No, that's not something I can update you at the moment. It hasn't been brought to my attention. Obviously, there are various claims where there are issues, problems, and certain checks have to be made. I know there is a large team working incredibly hard to get these payments out, and I will ensure, I won't be doing the next briefing, but I'll ensure that in the next briefing we have the answer for you on that one. If that's okay. So sorry I can't comment on that any further, but we will. So next we have Paul from MTTV. Paul.
Hello, Chief Minister.
Good afternoon.
How many days will it take to be completely free of any new cases before you can claim that we have got rid of the disease here, and therefore obviously things can be reduced restriction-wise very quickly? Have you set yourself a sort of goal to be free of this disease on so many days?
No, we haven't. We'll just keep on testing, tracing, monitoring, re-evaluating, looking at the data. I think we have to accept that the social distancing, hand washing, the 2 metre rule, that's going to go on for months, if not the rest of the year. That seems to be the general feedback from countries all over the world. Yes, we will be making small steps, hopefully on a regular basis. Obviously, we're just about to make changes that start from tomorrow. We've already said we will monitor those changes, and then we'll see how we can go forward based on the data that our medics are provided with from the testing and the tracing and the contact, etc. So I'm afraid I don't have a crystal ball. I can't say when this is going to end. All I can say is that your government, your medics, your public health officials, and all people in the fight against this horrible virus will not give up, will not stop until it's over.
And secondly, all media hear from people like doctors and that sort of thing off the record, but they obviously mostly don't want to be quoted because of fear of any retribution or if it's in their contracts. Now, the doctor's gone public today with his own video. Will he be in trouble? Will other doctors now be allowed to talk to the media if they weren't already allowed to? And will there be any retribution?
Right, well, that's not for me as a politician to say. It's not my department. I don't know if David wants to come in and give any comment on that. David.
Thank you very much, Chief Minister. As I've said, Paul, and I've said it twice now, Dr. Rankin is entitled to have his opinion. People are entitled to have views. They're entitled to disagree with people. I've laid out the position of government, the position of the department, and also the position and recommendations of the senior clinical leadership team and public health. We don't do retribution. I think I can't really believe you've asked that. We're not in the habit of turning on people for expressing their views. Dr. Rankin has expressed his view, and it's his personal opinion.
Are they allowed to talk to the media? You haven't answered that, because clearly, usually, people don't want to talk because they fear there's a problem because they put their head above the parapet. Well, are they allowed to talk to media?
Well, that will depend upon their contractual terms, Paul. And as a politician, I'm not involved in people's individual contractual terms.
So if this doctor in his contract is not allowed to, there would be repercussions. Surely you're playing down my question. I think. I'm sorry, but
No, I'm not playing down your question, Paul. Obviously, people have to abide by their contracts. But you use the word retribution. And I'm sorry, I've got to be quite clear on this. We don't take retribution against people.
Okay.
If there's something that's a breach of contract, then that would have to be looked at. But as minister and as a politician, I am not involved in terms of staffing matters and people's contractual terms. And nor would I expect to be.
Thank you. And whilst we obviously respect the views of an individual, they're not part of our senior medical team or our public health team. Right. Next we have Josh from ITV. Josh, how are you?
Thank you, Chief Minister. My first question is to yourself. Not all organisations that are eligible to work can work in a manner that maintains social distancing from tomorrow. I've had a man who got in touch with me to say his employees can't work in a safe way, and it's just not possible, and therefore they will not be working tomorrow. Will the government still financially aid these businesses who are eligible to work but choose not to?
Well, if they can prove that they can't comply with the rules that we're saying, they stay safe for their employees and the public, then yes, they will be continuing to get support. But I did actually get an email, Josh, today from someone who works with a group of 100+ people in a manufacturing company, pointing out that they work in a much greater confined places than the building industry will, and they've not had one case because they strictly adhere to hand washing, especially on a regular basis, and he was fully supportive of the changes and the way forward. So that's someone who's working out there with big numbers of people. So what we're saying time and time again is this administration, we are not saying you have to go back to work. We are saying if it's safe and you can follow all the rules and regulations, then yes, you can go back to work. There is a difference. And if you're in a position where there's no way that you can be safe if you go back to work at this moment in time, then you will be still entitled to receive the support that government has been giving you. Okay?
Okay, Thank you. My second question to Dr. Hewitt, please, if possible.
Okay.
Dr. Hewitt, can we have some clarity from a public health perspective to why, when we hadn't hit that original estimated peak number of cases, that people are now being allowed back to work? Why is it now safe enough for people to return to work tomorrow? And has that peak number of case estimation changed?
No, what the approach is based on suppression and release. We can't keep things suppressed as they are currently long term, because society wouldn't cope with it, either in terms of its social burden on people or indeed the economic burden. However, the virus is going to be with us long term, and we have to accept that. Current estimates based on the number of deaths we've had here, and if we assume that deaths can generally be taken to be about 1% of the total infections in a population, we've had about 16 deaths. That means only about 1,600 of our population has been infected, which is a bit less than 2%. That's very, very low. Now, we don't know if people can develop immunity to coronavirus, or whether we will just go on as we do with the common cold, being susceptible to it year after year. So we don't know if herd immunity is ever going to be a protective factor. That's when you get up to a certain proportion of the population who are immune, and because there are fewer susceptible people, the virus cannot spread in the way that it does when the whole population is susceptible. But even if herd immunity does prove to be something that can happen with coronavirus, the estimates are that you need 60% of your population to have been exposed and to have developed immunity before that becomes a useful factor. So we're currently at less than 2%. So A, we don't know if herd immunity will ever emerge, but B, if it isn't going to be a thing, we're nowhere near levels yet. So in one way, that's great. We closed the borders. We've been really good about social distancing and the hygiene, and we've kept infection rates really, really low. But that means that we've got a very susceptible population. So as soon as we relax things, the risk is that the virus will get out there again and we'll start going back up the curve. That's why we've got to have the test, trace arrangement in place to catch that quickly and suppress again on an individual case basis plus contacts, but also to monitor it to see that if the number of cases is starting to escalate and we're starting to go back up that curve, then we actually have to think about re-implementing more of the suppression measures. So that is probably going to be what things are going to look like here for quite some time to come. We may find that actually now we've closed the borders, we have actually suppressed thoroughly enough internally that we can let the restrictions off so long as the borders are closed. And time will tell on that. And we're going to go softly, opening the valve very, very gradually in such a way that we can reimpose measures quickly if things get out of control. But the borders are going to be key to that. And that, again, is something we're going to have to think about in the long term in terms of how that impacts on the way we can function as an island and as a society.
Thank you very much, Henrietta. Thank you very much, Josh. We now move on to Chris Kay from Energy FM. Chris.
Good afternoon, Chief Minister. I'd like to address Dr. Hewitt, if I may.
Yes, certainly, Dr. Hewitt. Yeah, away you go.
Since this pandemic reached the Isle of Man, the politicians facing questions have always followed the advice of clinicians and health experts. The Chief Minister said himself just before that he's listening to his senior medical and clinical teams. What is the latest advice being given to the politicians about when to reopen schools?
Schools is an interesting one. The social impact of not having schools and interrupting children and young people's education is massive. Not only in the short term in terms of their exam results, etc., but much longer term in terms of disrupting how children and young people learn to socialise, form relationships, etc., and also in terms of their long-term chances in the labour market and, lifetime earnings. And we know the impact on young people that disruptions have from the influenza issue about 10 years ago. That's the nearest we've got to this, but the swine flu pandemic ended up being a much lesser issue than we feared it was going to be. So it has to be said that we have simply not been in a position like we are now, definitely since 1918 and probably forever. So we're in very uncharted territory. So in terms of the potential damage of foregoing education, that means there is a good reason to try and look at the possibilities of reopening schools and education sooner rather than later. So then we have to look at what do we know about COVID and coronavirus in those age groups. And we don't know as much as we'd like to know is the short answer. And that actually is a feature of pretty much everything in terms of COVID and coronavirus. There are more known unknowns than there are known knowns. So what we do know about carriage in children and young people is that it is very much lower than it is in older age groups. So that suggests that children and young people are at less risk themselves, and they're also potentially at less risk of spreading to others, which would include, of course, teachers and education staff. So there are a number of reasons for looking at reopening schools sooner rather than later. But it's not an exact science, and we have to be open and honest about that.
Thank you very much for that.
Therefore, Chief Minister, are you having, or you or Dr. Allinson, the Education Minister, having discussions with head teachers and with the relevant unions to put together a plan which works not only for parents, but also for teachers as well?
Absolutely, Chris, and I think it's important. If you listened to the debate yesterday in the House of Keys, the Minister for Education, Sport and Culture, Dr. Allinson, did say that he was in regular contact with all the union representatives of the teachers' organisations, and is working with them and will be working with them now and over the weekend to come up with a strategy to take forward. That means that ensures the safety of our young people, but also, as I said the other day, the safety of our teachers. Could I also just point out, Chris, that I don't want to give the impression that our medics are running the island, that our medics give advice to the National Strategy Group, to the Council of Ministers. That advice is taken on board with numerous other information from various departments. Council of Ministers then makes a decision. That decision, if we have to amend legislation, then goes to Tynwald, and Tynwald has the final say on whether or not to support the changes that we make. But obviously, I have always respected the medics and the advice that they give us as we are dealing with something that is first and foremost about the health and safety of the people of the Isle of Man. Thank you very much, Chris, on that. And now, last but not least, we have Alex from the BBC. Alex.
Thank you, Chief Minister. When you returned on Tuesday and announced the partial relaxation of the lockdown, which we can expect to come into force tomorrow, you said that the public would be updated within the next day about the exact terms of that relaxation. We've still yet to see those exact terms, haven't we? What's happening with that?
Well, first and foremost, Alex, this isn't a relaxation. This is the next step forward. I've been keen to make out to put over time and time again. We will be making changes whenever we can, which is a step in the fight against COVID. So it's not a total relaxation of the measures we've put in place. The key measures of stay at home, social distancing, washing your hands, and all the other key messages that we've put out still stand. We are just tweaking changes to enable sectors of our community to get back to work, and sectors of our community to be able to handle and deal with the lockdown that we've had to put in place for people. So we've announced today that we will not be allowing sports to start up again. That had been something we were looking at as maybe bringing in, but we've decided today that really until we've seen how this goes with allowing certain sectors, the construction industry, gardening, window cleaning, etc., and the allied businesses that support those industries. Once we've seen how that works, then we will make further decisions. So we had maybe expected that we might have allowed some sports to start again in individual ones, but we don't feel that is quite the time yet. We will be reviewing over the next week to 10 days, and we'll come back and give the public that information. And obviously we will be giving further details of all the individual types of businesses that can go back, but I think it's pretty clear if you're in the construction industry, if you're a gardener or a window cleaner, what is allied services to those areas.
Okay, but when will that actual text be published though? Because in 13 hours time, the changes will come. People need to know exactly what they will and won't be able to do.
Yeah, that will be on our website, hopefully by the middle of tomorrow.
Thank you. And just as a second question, this could be for either yourself, the Health Minister, or Dr. Hewitt. The Isle of Man is about to become the first jurisdiction among our neighbouring islands, really, to alter its lockdown restrictions. Will you accept that this is a gamble? And are you prepared to take responsibility for the potential consequences?
Well, first, we're not the first. Alex, so I don't think that's fair to say that. The question is a little bit unreasonable. I announced yesterday that Guernsey were also altering their position on their construction sector going forward. I also said that Jersey hadn't stopped the construction industry. I also pointed out that Germany hadn't stopped the construction industry. So an awful lot of countries did not go as far and as hard as the Isle of Man did. We took a decision on the Isle of Man to go in hard to suppress the spread of the virus on the Isle of Man. An awful lot of the jurisdictions around the Isle of Man did not do that. We are now putting ourselves in a position where we are allowing our construction trades, etc., to come back to work, but we will be closely monitoring it. So I don't think it's fair to say that we are the first to do this, and that we're putting lives at risk. We are doing this based on the best evidence that we can get from our medical department and our public health department to take this forward. I don't know if Henrietta would like to add anything, or the Minister would like to come in on that. David, would you like to come in?
Yes, thank you, Chief Minister. It's just really to echo what the Chief Minister said, Alex. We're doing this off the data set. In the island, as Henrietta mentioned in some of her earlier comments, we've been able to suppress the virus down. That allows us to take the baby steps. And these really are baby steps. We can't stay in lockdown forever. Henrietta and the Chief Minister have both laid out the impacts on society as a whole if we try to stay in it too long. The Chief Constable, you heard, refer to domestic abuse and mental health the other day. So we have to take a measured approach, and that's exactly what this is. It is a measured approach. One of the big ones, of course, that people are commenting on is construction. But as has been emphasised before, places such as the UK and Jersey have never stopped their construction. Even Germany has not stopped their construction. So what we are reopening is, in some jurisdictions, something that they've kept going throughout the entire pandemic that they've had. So we need to be clear on that as well. But it is all based on the medical data that we have and the way we have suppressed, and we do have to do this step by step, and so there will be measures done at appropriate times based on the data we have. And I don't know if Henrietta's got anything she wants to add to that.
Only to endorse what's already been said, and to say that the whole approach is based on small changes, closely monitored, so that we can react to them if we find that cases are rising.
If I can just further clarify, Alex, that the website has been regularly updated. Yes, there's more information to be put on, but it's been updated all the time with the latest information. So if there's any information that you feel should be there and isn't, please contact me. But we are updating on a regular basis. Right, Mr. Moulton, you got your hand up for an extra question.
Yes, it's something we've been watching on Twitter today, this international pilot from the Isle of Man, a resident here anyway. He's been working with in Singapore, bringing in vital supplies. It's been a big story. But he can't get back to the Isle of Man now. He's been refused permission to be seen as a key worker to come home. He's, to say the least, not happy about that. He's written to various MHKs, and I wonder if you've got an opinion, if you've seen that story.
Well, I have had an email from the said person, and I've asked my officers to look into it. I think what's important is that the argument is at the moment in time that they are not a key worker for the people of the Isle of Man, and there are thousands of pilots working for British Airways and a number of other companies who live in the UK who can do these jobs. So we have found that the biggest way of suppressing the virus has been the lockdown of our borders. And obviously, we've said we'll look into it and we will get back to the person, but at this moment in time, those rules are there for a reason.
So you'd have to do 14 days quarantine if you could get back?
Yeah.
Right.
Amanda, I think you wanted to come in.
Yes, thank you very much, Chief Minister. Earlier this week, you said that the public would be worried after seeing the coronavirus situation in the UK, but that our position in the island was much better. Would you be able to provide us with more detailed data, perhaps including data from 111 calls, giving us a new indication of where our curve could go now, telling us what our value of transmission is, and all other data sources for that matter, to give the public a better indication of where we stand?
Yes, well, I'll probably bring in the Health Minister and then Henrietta for that one. But I would say that at the start of this, I remember we peaked at 800 phone calls a day to the 111 hotline virtually straight away. I think I gave the figures only a couple of days ago that we were down to about 38 calls to that site. So I don't know what the latest number of calls to the 111 site are, but that's a clear indicator. We've had, I think, 108 tests back yesterday, around 100 tests back today, so that's over 200 tests in the last 2 days, and we've had no cases, no positive cases of the coronavirus. But maybe I'll bring in the Health Minister to see if he wants to add anything to that, Amanda. David.
Thank you, Chief Minister. A very timely question, Amanda, because I'm leading the press briefing tomorrow, and you'll be pleased to know it's all around data. And I will be being joined by one of our clinical modelling team as well. So you should have all of that to your heart's content tomorrow after the press briefing.
Thank you very much.
You can see the joys and treats you've got to look forward to tomorrow. We'll finish with Sam. Sam, Alman newspapers.
You said about Abbotswood about at the minute, obviously the important thing is saving lives, but we may move forward into looking at what has happened there. Could we extend that perhaps? And would you consider establishing a Tynwald committee to look at the island's entire response to COVID-19?
Well, I can't speak for Tynwald committees because obviously I'm not a member of any of the committees. They investigate myself and other departments and questioning. But I would find it highly unlikely if they didn't want to do a review of how this administration and everyone else involved has handled the coronavirus once we've come through this fight with the virus, and that's something I'm sure I have to look forward to going forward. Sam.
Sorry, just if I may, what I meant was in terms of how we looked at climate change, how you established not a committee as such, but a group to create a policy towards that. That's a similar sort of thing. Whether you'd be able to take the lead on that from your office and suggest that would be brought to Tynwald.
Yeah, well, I think you started off by saying about Abbotswood, and really that's something that's up to the medics and the teams that do the investigations on what they choose to do. And I can't comment any further on that because, that's a situation that's ongoing, I'm sure, at the moment. So it would be wrong for me as a politician to commit to anything really on that. But we're on a long journey here, Sam. It's not going to be over next week. We're talking about months, if not into next year, before we start to be able to review and see what can we. But of course, we're always trying to learn from what's happened. We try and learn from other jurisdictions who were ahead of us in the curve. So I think mentioned yesterday, Italy, for example, on cancer treatments, you've got 5 times more chance of catching and having serious consequences if you're taking chemotherapy drugs, for example. So we're learning all the time. We will, of course, review, and anything that we can do to improve our handling, of course, we're going to do. So, but thank you very much. Anyway, I would like to end out with some shout-outs, please, if I may. First, it would be remiss of me not to give a formal shout-out to all the team who have gone in to support Abbotswood. People from across the island and across the medical and social care sector have stepped up to deal with this terrible situation. I cannot applaud them all enough. And with this shout out, I would like to make special mention to the cleaning teams. This is essential, life-saving work that maybe doesn't get recognised enough. Thank you. Secondly, I wanted to give a shout out to Peggy Scarf, 94 years young, from Douglas. She is fast becoming a social media sensation. Known as Queen Peggy, she set out to raise £200 for the Friends of Nobles Hospital by posting a video to the TikTok every time she raised £50. Having already smashed her target with £765 and counting, Peggy is now aiming for £1,000. Amazing stuff, Peggy. Thank you very much. Thirdly, yesterday we give a shout out to Skylar, who was painting and selling rocks to raise money for donations for the Health and Social Care Service. Her friend, 11-year-old Emily Collister, also from Castletown, is doing the same. So far, Emily has raised over £120. Both girls are showing initiative by doing their bit to help in these difficult times. It's so impressive for those that regularly criticise our young people. Here's a good example of them doing a fantastic job, and who knows, entrepreneurs of the future. So wrapping up now, I just wanted to say that it's been great to be back at our press conferences this week. I have missed it, and I've missed you all and the feedback. As I mentioned, I will be handing the reins to the Health and Social Care Minister for tomorrow's briefing. We then have other ministers for our weekend briefings to update you on their areas of responsibility. I hope to be back on Monday. I look forward to seeing you all then. In the meantime, please have a safe weekend. Stay at home if you can. And if you do decide to go out, please make the right choices for your health, for the health of your family, and for your community. Before I go, I did want to give a plug for the Isle of Man Sports Awards. You can watch it from the comfort of your own home this evening, as the event is shown online for the first time ever. The annual award ceremony was postponed last month in response to the coronavirus pandemic, but organisers, Isle of Man Sport, wanted to ensure the dedication and successes of local sportsmen and women was recognised and celebrated. You can watch all 11 awards being made on the Isle of Man Sport YouTube channel and social media platforms starting at 7 p.m. I will leave you now with a word from some of the nominees. Remember, the safest place to be is at home. Thank you.
Hi everyone, it's Mark Cavendish.
It's Joseph Reed.
It's Charlotte Atkinson.
It's Duncan Watterson.
Libby Priest here.
Lisa Kenyon.
Anna Christian.
It's Tom Gandy.
Thank you to everyone working so hard to keep the island safe.
I hope you're all staying positive in these difficult times.
We've come so far.
And we're all in this together.
For your island, for your community.
Stay at home.
Hi everyone, Mark Christian.
It's Lizzie Holland here.
It's Phil Crindle.
Hi, it's Erica Kelly.
It's Tim Neal here.
Zoe Jillings-Bryan.
It's Sean Jackson.
It's Tara Ferguson. I just wanted to say a big thank you to everyone helping keep the island safe.
We've come so far.
And we're all in this together.
Your island.
For your community, stay at home. Please stay at home. Thank you.
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 Stay at home. Be safe.